being a safety net provider, we've always been right around a break even 1% margin. And that produces enough capital to replace facilities and to maintain services that don't have a positive margin. What we've seen in the last 12 to 24 months has a significant increase in our expenses around labor, somewhat increase in our supplies. And then what we've also seen is the reimbursement in most cases is actually getting worse. In Ohio, we've seen over 4,500 inpatient beds close in the state since the beginning of COVID. We've seen 10 labor and delivery services close across the state. You've seen reductions in behavioral health beds and different access points. So we've been very conscientious of that. And what we've seen is that we're getting sicker and more complex patients coming our way. We recently announced that we are closing our smaller of our obstetric facilities that only did about 500 deliveries a year. And we'll be moving those deliveries over to our major facility, which does about 4,500 deliveries a year. We're looking for funds and grants to provide workforce development. So we've gotten into the business of providing education to develop phlebotomists, medical assistants, LPNs, RNs. And so having the ability to get funds for that, either a grant or some kind of tax credits for those individuals going forward. We also know that there were certain programs around distressed hospitals and getting those designations clarified as to who qualifies for those. So much like the rural hospitals have gotten special designation, the anchor institutions, the safety net providers getting recognition for that care. Because in the end, if the safety net providers start to have to limit access, where will people get their care?